So, what are some of the duties of a chief executive officer?
Well, I suppose I like to think of it as a team captain. You're a leader of a lot of excellent, very well qualified people, and trying to pull their talents together and create a vision of what you see the clinic's role in our communities, and I think you kind of help people move in that direction. I've been grappling with that question a lot myself for the last 3 months. So I'm learning a lot about finances. Finances have always been probably one of the areas I would say I would be weakest in the business world. They say doctors go into medical school and they can learn all the skills to become great doctors, but they don't often learn the business skills, and I will confirm that. That probably wasn't a part of my training. So I'm learning about finances, and I'm just helping to keep the different departments, progressively growing and improving and trying to continue to get better.
Are you substantially financed by the fees, or do you get government funding?
Yeah, so we are what's called a federally qualified health center. So that does mean that we receive some federal funding. So we have a grant that we get every single year. It's in February that we have to produce all of our quality indicators, and we have to show the federal government how many people we're seeing, individual people, and then how many total visits in a year. And then they do provide about 20 to 25% of our total budget. And so from there, we bill all insurances. So if people come in for a visit and they have Medicaid, we bill Medicaid. If they come in and they have Medicare, we bill Medicare and any private insurance. The reason why the federal grant is there is for those patients that have no insurance, and to subsidize a little bit of the idea of what we call team-based care. So team-based care is the doctor, it's not just a doctor and a nurse anymore. There's multiple players that participate in helping people to participate in managing their health care. And so we use those federal dollars to help us cover people who are uninsured and go on to what's called a sliding fee schedule. And they pay just a nominal amount based on their income. And then we use the other money to help kind of protect some of the programs like care management, and we have clinical pharmacy, and we have behavioral health specialists, and we have a lot of people who participate on the team to try to give the best medical experience in primary care.
So you guys kind of integrate the care. So.
Yep, it's an integrated team model where all of us are working side by side, same room, talking about the best way to help somebody. If a lot of times if someone comes and sees me, the number one thing they might need is some access to, a caregiver, somebody who might help with groceries or come by and clean the house once a week. And the medical background that I have doesn't really get us, anywhere to solve that. So it is using our care managers and understanding the resources in the whole community that helps us to, really deliver what's really needed most by the patient that's in front of me.
You became CEO in September, right? Mm-hmm. Right, and then before that you were the medical director, so.
Yep, so I started at Southwest Montana Community Health Center in 2007. It was my first job after I finished residency. Residency was in Salt Lake City, Utah. And I moved here because I always considered Butte and Southwest Montana home. My grandparents lived here. I was born here at the General Hospital. I lived here. I lived in Anaconda until I was 12. And so for me, my elderly grandmother was here, so it was a great opportunity to return home. She had my practice full of most of her friends when I started, so building a practice was super easy, and I always knew I wanted to really specialize in geriatrics and palliative care, and so I was able to do that. And then I think just by the nature of the way sometimes things work, if you like to do leadership type work, you just sort of move into those types of channels. And so I became medical director right away. I was almost medical director for 12 years before the transition. And we watched the clinic grow. We've definitely increased the number of medical providers we have. We've we've had a little bit of turnover, but I think in the grand scheme of things, we've really held on to medical providers fairly well. Behavioral health providers and dental providers do turn over a little bit more than I'd like to see, so that'd be something that would be, worthwhile trying to fix. And then I never thought I was going to be the CEO. That wasn't really in the plan.
Right.
But one thing you learn about health centers and big healthcare organizations, I would say, is that the institutional knowledge of people who have been there, they sort of understand the federal grants, they understand the way we are financed, understand the quality and the reporting measures that we're up against. Those are things that after working there for 12 years, I knew all about that. So I think it was an easier transition than one might have thought, but it wasn't the plan.
Right. Well, I think a lot of times people are, other people have their eye on you for jobs.
Mm-hmm. Yeah. Yeah.
Or it just seems like I often hear people that are in positions of leadership that they had no desire to do this. Somehow here I am.
The power of being a good leader is probably learning the right time to say no and the right time to say yes.
Right.
And that's one of the things that it's an art form, just like practicing medicine. You have to sort of juggle. When do you say no? When do you not say no? And this just seemed like a great opportunity for me to continue to serve the community. And even as the medical director, I was seeing patients 2 days a week, participating in administrative time the other days. And so nothing in my life based on the time has changed. I'm still seeing patients 2 days a week and working as an administrator 3 days a week. And the best part about it is that the entire team, we have a clinical pharmacy director that's been there for years. That's Tammy Cox. We have a financial advisor, our CFO. She's been in the business a long time. We have really great leadership in the building. Dr. Brewer is the person who stepped into the medical director, and she started 1 year after I did. So she has, almost the same track record with the time with the organization and understanding what it needs as I do. So.
And you guys have a long-standing professional relationship.
Exactly.
As well. That's
yep.
nice.
So I think that made the transition. My experience having hired a couple of CEOs since I've been there is that, that dynamic of being able to come in and work with your executive leadership team and really just kind of all start to gel together, that takes some time. And so if we would have hired somebody brand new that would have had to come in and learn about the grant funding and the FQHC status and get to know all of our quality measures and didn't have any of the historical knowledge of, even our EMR, it's a large learning curve for someone to pick up on.
So you guys were gelled in advance.
We were gelled in advance during a pandemic. I don't know. It doesn't get much better than that.
I just thought of this, but I heard you speak at a listening session when Senator Tester was here. It was years ago. But one of the things you brought up was how much red tape there was in getting drugs approved for patients and that sort of thing. And are you able to, in your new position, are you able to facilitate that more? Or I don't know. That's probably a terrible question.
I don't think I'm able. I don't know if I could say I'm able to facilitate that more at the individual level, but what I have learned through the role as in the leadership position is we play a very large role in the political spectrum. And so that is one of the duties. Like if I were to list the top 10 or 12 duties of a CEO, working in the political arena is a very important piece because we bring expertise to the table, and if I'm not participating, then how am I going to expect that our senators and our congressmen and our local legislators really understand what the red tape is? And so I see my job as someone that has lived it, understands what patients struggle with, and then in the leadership role, I'm able to get on those committees, be a part of those press conferences, write those letters, be a part of the dialogue with the political arena.
Right.
So I would say yes, I think it has been, I would say the red tape hasn't gone away.
Right.
Did you know that 88% of online shoppers consider reviews when making a buying decision? reviews are the deciding factor for consumers choosing between you and your competitor. Negative reviews can do serious harm if left unchecked, while positive reviews can lead to a healthy increase in your bottom line. In both cases, it is important to actively respond and manage all reviews to build the trust of your customers and keep them coming back. A good online reputation also considers how accurately your contact information is displayed and what people are saying about your business outside of reviews. But it doesn't stop there. Search engines like Google take your reputation into account when ranking your business on search results. So the better your online reputation, the better your chances are of getting found ahead of the competition. Take control of your online reputation and start bringing in more customers today.
To find out how Butte News Digital Services can help your business, call us at 406-861-4625 or email us at digital@ButteNews.Net.